Before I get into the movements of the knee joint, I'm going to explain some of the materials that I used. I used clay to construct the pelvis, femur, patella, tibia, and fibula. I used clay and different colors of clay to represent different features on the tibia and femur. And if I remove the patellar ligament and the bursa, I used different elastic band colors to represent the several ligaments. I also use thick and thin red pipe cleaners to represent the 5 muscles that I chose. I also used a flexible gardening wire to easily demonstrate the movements of the menisci. Are fibrocartilaginous discs that are between the tibia and the femur. I have a beige elastic for the medial meniscus and I have a red elastic for the lateral meniscus. The specific job of the menisci are to improve congruency between femur and tibia, reduce friction, aid in movement, and most importantly, have a role in shock absorption. They also help the fairly flat tibial plateaus fit closer to the fairly round femoral condyles. Next, we have the 2 collateral ligaments of the knee. We have the medial collateral ligament in the blue elastic, which attaches from the medial femoral condyle to the proximal tibia. And then we have the lateral collateral ligament, which attaches from the lateral femoral condyle to the head of the fibula. And the job of the medial collateral ligament is to resist any valgus forces. And the job of the lateral collateral ligament is to resist any varus forces, which is the tibia being positioned medial to the thigh. Then we have the 2 cruciate ligaments. We have the anterior cruciate ligament, which is in the purple elastic, and that attaches from the anterior aspect of the tibia passing superior and back to the inside of the lateral condyle. Its function is to resist anterior displacement of the tibia. Posterior cruciate ligament in the orange elastic, and that attaches from the posterior tibia superior and forward and attaches to the inside of the medial femoral condyle, and its function is to resist posterior displacement of the tibia. Another unique feature of the knee joint is that it has bursa. And in my model, I used this clear wrap to represent 3 bursas that are on the anterior aspect. And the job of the bursa to reduce friction during movement, it is a fluid-filled sac that is usually positioned between a ligament or tendon and a bony feature. A subcutaneous prepatellar bursa from the quad tendon, and the quad tendon and patellar ligament are also in white clay. Then I have the deep infrapatellar bursa, which is underneath the patellar ligament, and I have the subcutaneous infrapatellar bursa, which is on top of the patellar ligament. The knee joint is a compound one that is made up of the tibiofemoral joint, which is classified as a hinge joint, and it permits movements of flexion and extension. It also has a very small ability to adduct and abduct. It is also made of the patellofemoral joint, which is a gliding joint, and it is largely restricted to gliding up and down the intercondylar groove of the femur because it is embedded in the quad tendon and because of the high bone congruency. Next, we have the patellofemoral joint, which movement occurs between the patella and intercondylar groove. In full extension, only a little bit of the patellar surface touching the intercondylar groove, which is the inferior aspect. In slight flexion, so when we're at about 30 to 45 degrees, there is more contact, middle region. When we get into deeper flexion, contact the superior aspect. And if you go beyond that, like 135 degrees, patella gets more force or contact onto the outside edge of the medial facet, which is known as zone 4. When we are extending, we are engaging our anterior compartment of the thigh, which are our quadriceps. Here I have 3 of the quadriceps. Vastus lateralis, which originates on the lateral side of the femur and inserts onto the tibial tuberosity via the patellar ligament. I have the vastus medialis, which originates on the medial side of the femur and also inserts on the tibial tuberosity, and the vastus intermedius, which is in a thin pipe cleaner because in real life it is non-visible, and that also inserts onto the tibial tuberosity. When we are flexing the knee, we are engaging our posterior thigh, which are our hamstrings. And I have two of the hamstrings. I have the semimembranosus, which originates on the ischial tuberosity of the pelvis and inserts medial condyle of the tibia. And I have the semitendinosus in a thin pipe cleaner that originates on the ischial tuberosity of the pelvis and inserts proximal medial tibia. This helps to flex the knee, but it also helps to extend the hip.